Okay, good morning, good afternoon, good evening. Once again, this is Mr. Munyanyembe. So, we want to look at what urinalysis. So now, what is urinalysis? Urinalysis, this is a procedure that is done where you collect urine from the patient in the ward, and then you check for the urine contents. Yes, so you look at the physical properties as well as the chemical properties of urine. What are the indications of this procedure? So the indications are DM, which is diabetes mellitus, sexually transmitted infections, which is the STIs. In pregnancy, you can check urinalysis, or you can do urinalysis if the patient has eclampsia and or preeclampsia. Yes. So now, this procedure is a clean procedure. You do this procedure, or this procedure is performed from the sluice room. This procedure is done from the sluice room, or you can simply collect urine and you take the samples to the lab so that they can also do urinalysis there. Then you just go and get the results. Yes. So, what are the requirements of this procedure? So on the station, you are going to find clean gloves, the bottle containing the multi-sticks. You are going to find a receiver with the tissue and the pipette or the dropper. And then you are going to find the test tube, a piece of paper and a pen where you are going to record your findings. And you are going to find the urine on the station in the jug. So the jug is got the graduations where you have to read the amount. Yes. So before we begin the procedure, let's look at let's talk about the chemical properties. What I mean is, we look at what it means when you find that glucose is positive, for example, or you find that when you do urinalysis you find that there's blood. What does it mean? Or maybe you do urinalysis and then you find that nitrate is positive. What does that mean to you? Yes, so we start with the glucose. So when you do urinalysis and then it comes out positive, when you do urinalysis and then you find that glucose comes out positive, it means that the patient has got diabetes mellitus. We move to the next one. You do urinalysis and then you find that bilirubin is positive. That will simply communicate to you that the patient is having a liver condition. Yes, just a quick one will be fast. Then you do urinalysis and then you find that the ketones are positive. What does that mean to you? That will simply communicate to you that the patient is having DKA. The patient is starving. Yes. Specific gravity. What of specific gravity? So if you find that the specific gravity is above the normals, so the normals is supposed to be 1.010, and between 1.010 and 1.030, between those ranges. So what if you find that the findings or the results comes out at, maybe it shows you the color which is at 1.000, that may indicate to say the patient is dehydrated or the patient is hydrated. So it simply means to say the patient is hydrated or dehydrated. That's for specific gravity. What of blood? So if you do urinalysis and you find that blood comes out positive, that may simply indicate to say there is trauma to the kidney, the urethra, or the bladder itself. Yes. What of pH? So for pH, you are looking at the alkalinity and the acidity of urine. So the normal pH of urine is supposed to be between 4.5 and 8.0. But for the normal is supposed to be 6.0. So urine is acidic in nature. Yes. So if you check and then you find that it's above 7.5, that simply communicates to you that the urine is alkalinity, of course. What of proteins? What of proteins? So if you check and then the protein comes out positive, that may indicate to say there is pre-eclampsia or eclampsia itself. How about urobilinogen? For urobilinogen, it may indicate that there is also a liver disease or a liver problem. There is a problem to the liver. How about nitrates? So for nitrate, this may indicate to say there is an infection. There is an infection or UTI to be specific, which is a bacterial infection. Leukocytes. So if the leukocytes comes out positive, it may indicate that there is an infection. So there are some antibodies trying to fight off the infection in the body. Yes. So those are the interpretations. Okay. So now, let's begin the procedure. Of course, you begin the procedure by washing your hands. So wash hands and dry them. Okay. Then the next thing you do, you don gloves. Don clean gloves. Okay. So there are issues of contaminating the bottle. So at some point we are going to remove this part of a glove from this hand. So after donning gloves, you start with the physical properties. So for the physical properties, you are looking at the amount of urine. You are also looking at the smell, the color of urine, and the contents of urine. What I mean by the contents is you need to check, is there blood in urine? Is there pus in urine? Or are there particles in the same urine? Yes, so you have to check. Okay, so let's start with the amount of urine. So for the amount, I said, like I said in the first place, I said that this jug is got graduation. So you don't have to lift the urine and then you start checking like this. It's not going to be possible for you to get the correct reading, but you need to put it on the flat surface like that. And then you just bend and see. So you'll be able to see on the graduations there. So the amount of urine is 400 mils. 400 mils. That's the first physical property. The second physical property is you're going to look at the color of urine. So for the color, it's supposed to be straw amber or clear amber. So you're going to tell the examiner to say, my examiner, the urine is, the color is straw amber or clear amber. That's the second property under the physical properties. The next thing you're going to look at, you need to check for the smell. So for the smell, what you're going to do is, you're going to get a pipette, then you put urine in the test tube. Okay. So you use this thing, you do this until it's enough. So in this case, let me just pour, because we are going to waste a lot of time. Okay. But you are supposed to use this. Okay. So after you do that, you need to lift and then you need to smell the urine. Of course, don't bring it too close to your mouth. Remember, you are dealing with urine. So for the smell, you are going to say, my examiner, the smell is aroma. The smell is aroma. Or you say the smell is aromatic. That's the third property under the physical properties. The last thing you are going to talk about, or the last things that you are going to talk about, you are going to see, is the blood, so is the urine containing blood? Is it blood stained? You need to check. Is there blood there? Apart from that, you also check, is there pus? Is the urine looking cloudy? So if it's cloudy, you tell the examiner to say, my examiner, the urine is cloudy, or the urine is containing blood. You see, blood stained. If there is pus, mention to say, my examiner, the urine is containing pus. The last thing you are going to do, you are going to use the piece of paper here. You check for the particles. So you do this on the piece of paper, then it will help you to see if there are particles inside there. So in this case, there are no particles. So you are going to tell the examiner to say, my examiner, there are no physical particles in the urine. If there are particles, if you're able to see particles, you need to mention to say, my examiner, I can see there are physical particles in the urine. Okay. After you do that, the next thing you are going to do, you are going to now concentrate on the chemical properties. So we are done with the physical properties. Okay. So let's now look at the chemical properties of urine. So what you are going to do is, remember I said there are issues of contaminating the bottle itself. So you are going to remove this glove, and then you use this hand to open the bottle. So you do this. And then before you take the stick out, you are going to say, my examiner, the expiry date of these mouth sticks is in February 2027. Yes. And then you are going to pick one stick. So you do this, and then you have to close like that. Then you are going to dip this strip in urine. So you are going to dip this at least 2 to 3 seconds. After you do that, you have to remove the urine there, and then you are going to do this now. You need to start comparing from what is on the bottle and the colors that are changing there. So you are going to start reading from the bottommost. So the bottommost there is glucose. So you start with glucose at 30 seconds. So after 30 seconds, you start reading to the examiner. So you say glucose at 30 seconds, you compare the colors. So glucose at 30 seconds is negative. It doesn't change. You move to the next chemical property. You are going to say bilirubin at 30 seconds is also negative. It doesn't change. You move to the next one, which is ketones. So ketones at 40 seconds. Ketones at 40 seconds doesn't change. So it's negative. You move to the next one, which is specific gravity. So specific gravity at 45 seconds, it has changed, of course. It's 1.020. 1.020. You move to the next one, which is blood at 60 seconds. So blood, it hasn't changed. It's negative. You move to the next one, which is pH at 60 seconds. It has changed to 6.0, which is normal. There, 6.0. You move to the next one, which is proteins at 60 seconds. So proteins at 60 seconds, it's plus. 4 plus. So you are going to say, you're going to write 4 plus or plus 4 plus. Yes. I don't know if you understand what I mean there. You write a 4 and a plus, or you write the 4 pluses, like, yes. I don't know if you get it. Then urobilinogen. For urobilinogen, it hasn't changed, so it's negative. Nitrate, it hasn't changed, it's negative. Leukocytes, for leukocytes, it's positive. This one is positive. Okay, so we are done with the chemical properties. So this will go in the bin, or you can simply put it there. As you'll be discarding the gloves, you also discard the strip. Yes. So what you do, you remove this glove. Before you remove, you get this urine, you pour back there, and then you remove this glove and you start documenting. So you start with the physical properties. So for the physical properties, we said the amount is 400 mils. The color, which is a clear amber or straw amber. Then the smell is aroma or aromatic, if you like. And then for the contents, so there is no pus. You say no pus, no blood, no physical properties. And then for the chemical properties, you are going to say leukocytes positive, glucose negative, specific gravity which is 1.020 until you finish everything there, because remember you have to document. You need to write down your findings. So after you do this, you are going to show this one to the examiner, because the examiner has to see what you have done. Remember, what is not documented is not done. Yes. So you are going to, the last thing you are going to do is, after giving this to the examiner, you're going to wash your hands and you dry them. Okay. So guys, thank you very much for following. Make sure you don't, make sure you go through the procedure. Remember, you need to practice so that you know the procedure. Okay. Remember, practicing makes it perfect. Okay. So I want you to subscribe. You can actually subscribe on my YouTube channel. Yes. Make sure after watching the video, you also hit the subscribe button so that you'll be able to see the videos that I'll be posting each time I post. Okay. Also follow me on TikTok. I'm also on TikTok for Osce tutorials, of course. Thank you very much and cheers.